All right, we're just at 5 o'clock and it looks like I'm going to be alone today, and that's fine. I do want to offer these Friday afternoon opportunities to come in and be together and talk about anything that has come up during the week. I know a lot of you work at this time and you just can't attend. But even if nobody is able to come during a week, I will still come on Zoom and I will talk about some things that I think might be important for the week. For those of you who haven't met me yet, my name is Dr. Piscopo, and I'm your instructor for Anatomy and Physiology lecture this spring. So let's go ahead and get started. Looks like Adam is coming in. Hi, Adam. It looks like it's just you and me tonight, or at least so far, it's just you and me. I was just saying a few things that will end up on the recording of this meeting. As people come in and out while we're on these Friday afternoon meetings, we can address questions if you have any. And the other purpose of the meeting is for me each week to review things in our lecture topics for the week that I think might be difficult or confusing or might need a little bit more explanation. So what I'm going to be talking about today is a topic that's towards the end of this first lecture that you all viewed this week, the lecture, the introduction lecture. I'm going to say a few things about homeostasis and negative feedback. But before I start doing that, let me ask if you have any questions that you need me to answer today. You can type them into chat, or you can just speak out if you don't mind unmuting yourself.
Actually, I don't have any questions about the topics presented.
Yeah.
The only thing I had a question about was the Proctoria software. Is that just going to be used for the tests, or is that also for the weekly homework?
The lockdown browser, are you talking about?
Yes. Yep.
That's only for the examinations.
Okay.
Yeah. When you take your weekly lecture quiz or homework, depending on what you want to call it, you're actually free to have your notes with you and to take as much time as you want and all that good stuff. So,
okay.
So those we don't do through lockdown browser. But the exams we do through the lockdown because it adds a layer of security for us. Students are not allowed to use any materials during the examinations. So when it comes—
I'm sorry, I just lost you.
Oh, that's okay.
Audio wise, I'm not sure if it's me.
It could be me. I don't know. I was just saying that when it comes time to take the exams, when you sit down to take the exam, you'll have to go through the lockdown browser on Canvas. But you don't need it for the quizzes.
Okay, that's good. Okay, great.
That answers your question.
It does, yes. Thank you.
You're welcome. Hi, Jessica. Welcome. We're just these meetings are just casual, Jessica. So if you have any questions that you want to ask about our course, how it's structured, or the lecture material that you had to view this week, feel free. You can either type questions into the chat, or you can unmute yourself and ask questions. That's fine too. And if you don't have questions, that's okay too, because I was just explaining that one of the things we'll use these meetings for each Friday is a chance to review some of the more complicated material that is in the lecture assignments for the week. Now, obviously, this week was just an introductory lecture. Most of the material, I think, this week was pretty straightforward. But I am going to say a few things about homeostasis, just because that topic and the topic of negative feedback can be a little confusing, I think, for students. So, but let me ask, is there anything I can answer for you?
Nope, you actually, that was the one. So on Canvas, I think by being in A&P, we get that preparatory thing where we can do the practice quizzes and stuff.
Yes.
And actually repeatedly doing it where I'm scoring low on points is that. Like I got 95%, but it's always that. I think for some reason, I'll see that affector instead of effector, and it throws me off. Because I also didn't see in the reading or anything affector. I saw effector a lot. So that's why I'm like, I don't know why I'm getting confused, but I'm getting confused on that.
Listen, those two words are very confusing. People get them wrong in everyday language. And I wish I had a really good method for how you keep them straight, but I don't.
Me neither.
The word affector, or afferent, which is a word we use a lot in anatomy. That's information that is heading toward someplace. So anytime you hear me talk about an afferent pathway with the letter A at the beginning, that pathway is going toward a destination. Now the word efferent with the letter E at the beginning, that's a pathway that's traveling away from a central place. So when we talk about the stimulus response pathway, remember that the receptors that are out in the body, all over the body, receptors are picking up information all day long, 24 hours a day, 7 days a week. It's how we can know what's happening in our world and what's happening in and on our bodies. We're covered in receptors. And these receptors pick up certain pieces of information. Sometimes it's about temperature, or it could be about exposure to a certain chemical. It could be about touch. It could be about pain. Each type of receptor picks up a different piece of information. So the receptor is receiving information and sending it for analysis, if you will, towards a control center. Now, in the human body, the control center includes the brain, the spinal cord, and some of the endocrine organs, some of the hormonal organs in the body. So when a receptor sends information to the central control, that's on an afferent pathway. Now, the central control is going to interpret the information. Your brain is receiving information from all over your body, in and on your body, as well as outside of your body. Think about what your eyes and ears pick up all day, and your nose. All of that input is going along afferent pathways to that control center, that central control center. The control center puts all the information together and determines what a response is appropriate. And the response then is going to travel along an efferent pathway to an organ that's going to cause something to happen. And we talk about skeletal muscle and smooth muscle, and also glands being those effector structures. They're going to make something happen as a response to that information that was received. If it helps, we use afferent and efferent. but there's a similar word. There's a similar pair of word, affect and effect. Those get confused all the time when people write.
I
It's the
know, I'm
same
constantly,
idea.
like,
It's the
doing
same
the-
idea. And
I constantly go on to like dictionary.com before I type something up to be like, which one am I
is it
using?
affect or effect? Right. An affect is happening to you, and an effect is the response. So it's very similar.
Yeah.
But I know it's very hard to keep them straight. And unfortunately, I don't have an easy way for you to
Yeah.
memorize that.
Yeah, because really the only two like type questions I put down was that, just that's what I'm tripping up on. And then the other one was just like down the road, say like we have an exam. I know we should get in the habit of knowing our anatomical terms and all that and the correct. So like on that preparatory, there was someone's facing like away from the mirror. So I kept writing palms facing forward.
Yes.
If we were to take a quiz, would you accept that? Or would you want palms facing anteriorly?
Remember that. So you're referring to what we call anatomical position.
Yeah.
When we want to start using directional terms in anatomy, we have to all have the same starting place. So when a person is in anatomical position, their palms are facing forward, like you said. But since we're learning anatomical language and directional language, it is better to say the palms are facing anterior. They're facing towards the front of the body, the front surface of the body. So, but if you're thinking it's not, I suppose it's possible, but it isn't usual for us to say, define anatomical position. It's much more common to have a question on an exam say, is the elbow more proximal or more distal than the shoulder? You see what I'm saying? As long as you know anatomical position, what a person looks like when they're in anatomical position, remember that means they're standing up straight, they're facing forward, and their palms are facing forward.
Okay. Because
as long as you know that, then you shouldn't have trouble figuring out what things are proximal, what things are distal, what things are
I was just wondering for like grading, because when I did that prep, that's where I got marked off. And like I wrote facing forward and it had it written in as like facing anteriorly.
Anterior, right.
So I was like, what would I like? Would I really lose a point, or once like the teacher reviewed it, would it be an acceptable grade? You know what I mean?
Yeah. I think on that question, what they were going for with you was they wanted you to start practicing using the right terms.
Okay.
We want to get away from using the language that we're all very comfortable with. We're all really comfortable with forward and backward and up and down. And we have to stop that now. Now we have to say things like superior and posterior and anterior and proximal, and we have to use directional language now. But that's a good question. You're going to find that in this course anyway, you are going to be particularly examined, particularly tested on directional terminology in the laboratory portion of the course.
Okay.
I do tend to ask a couple questions about it on the first exam, but very straightforward questions, like the one I just mentioned. You know, is the elbow proximal to or distal to the shoulder, or is the ankle more proximal or more distal to the knee? In lecture, we sort of lay out the foundation for anatomical language, but it's really practiced more in laboratory.
Okay.
If that makes sense. But I'm glad you brought up the stimulus response pathway, because I think a lot of students get confused with that concept. The general concept of how the human body receives information and then responds And it gets a lot clearer when we talk about the nervous system. Because remember, the combination of the nervous system and the hormonal system or endocrine system in the human body, those are the two things that are really in charge. Those are the two things that are doing most of the work of keeping our bodies functioning every single day. And our central nervous system, our brain and our spinal cord, act as the control centers for human beings. So we take information in all the time with those receptors I mentioned, and you have receptors all over you and all inside of you. They're connected to nerve pathways. All of those receptors are connected to nerve pathways. And again, when we talk about the nervous system, we'll start using those words afferent and efferent, because all of the nerves that take information to the brain and spinal cord are afferent pathways. All of the nerves that take information away from the brain and towards whatever responding organ is going to do something, those are efferent pathways. So you'll hear that language throughout the course. What I really wanted to talk about, though, and you may not have had a specific question about this, but I want to talk just a little bit about the homeostasis concept and how it relates to feedback, because this can be really confusing, I think, especially when it comes to negative feedback. And I also want to add that it's important to know that on our examinations, in the lecture portion of the course anyway, on our examinations, about 65% of the points, so 65 out of 100 points, is going to be multiple choice questions. The other 35% is going to be short answer, short essay type questions. And where students struggle the most is on those essay questions. Generally, there are, so 35 out of 100 points. There are usually 2 questions that are worth 10 points and 1 question that's worth 15 points on our exams. And the way they're graded is that we grade for both accuracy, did you have the right answer? And we grade for completeness. Was your answer thorough? And did it include enough information to show that you understand the concept? A lot of students struggle with writing essays, and they struggle with putting in a full and complete set of information. So I promise you that homeostasis and negative feedback are going to show up again in this course. And that's something we do tend to examine you on. So I want to make sure that everybody has a complete understanding of it. So if I go, I'm just going to pull our slides up just so we can all, we can refresh ourselves, refresh our memory about this part of the lecture. So that's what you should be seeing on your screen right now. You should see the slide that says concept of homeostasis on it. This is right at the end of that introduction lecture. Homeostasis is, it's a state that the body is in. That's the first thing to know. Now we define it as a tendency towards relatively stable equilibrium. That definition, to my mind, it's tough because it doesn't feel like you can grasp the meaning of the word very clearly. I want you to think of homeostasis as a state that the body is in or not in. It's a stable, sort of predictable, managed state. It keeps the body, when you're in homeostasis, the body is in a state where it functions most effectively. So for all of our body systems, all of our organ systems, there is sort of a sweet spot for performance. There's a sweet spot for your blood pressure. There's a sweet spot for your heart pumping, your blood pressure, your body temperature, your digestive rate, how fast you're breathing, your reproductive cycle, if you're female. There's a stable state that each organ system wants to be in. It's functioning as effectively as it possibly can. So the body spends a lot of time and energy trying to keep us in homeostasis, trying to keep us in that maximum performing state. Now, for each organ system, it means a different thing, right? For each organ system, being in homeostasis means a different thing. But the whole body can be in homeostasis when all of the organ systems are performing optimally. Now, the way we determine, we measure if our body's in homeostasis is by looking at different variables, looking at things like your body temperature or your heart rate or your blood pressure. There's lots of variables that we can measure in a human to help us know if that body is functioning optimally. So when you go to the doctor's office and they take your vital signs, the reason they're doing that is to see if your body is where it needs to be, if your body's working the way it's meant to work, and it's in its optimal state. You don't have to measure every single variable in a human body every time you go to the doctor's office, but those three, temperature, heart rate, blood pressure, if they're good, chances are the other ones are good too, because you're in a state of homeostasis. Now, the body stays in homeostasis because of feedback. The body stays in a state of homeostasis through feedback mechanisms. And there are two kinds. There's positive and negative. If you remember from lecture, most of the feedback loops, as we call them, most of the feedback loops in the human body are the negative type. There are a couple that are positive loops, but there are mostly negative feedback loops. And all that word negative means is that if the variable changes in one direction, the negative feedback loop is going to bring it in the other direction. That's all negative means. If some variable that you can measure about an organ system starts to change, starts to go up or down in its value, that's going to be detected in the body by those receptors we talked about. That's going to be detected, that change. And these negative feedback loops are going to respond. They're going to take that variable in the opposite direction that it's going. So if your body temperature starts to go up, a negative feedback loop is going to kick in and it's going to bring that temperature back down. Now, remember, we said there are normal ranges for all of our organ system variables. Let me bring that slide up. Relatively stable is important when we talk about homeostasis. It doesn't mean that all of these things that we can measure, temperature, blood pressure, whatever, it doesn't mean that they stay at exactly one value when you're in homeostasis. It means they stay within a normal range. So even though we're taught, in elementary school that, normal body temperature is 98.6, there's actually a range, right? There's a range of normal body temperature. 97 Fahrenheit to 99 Fahrenheit is the normal range of body temperature in a human being. There are normal ranges for all the variables that you can measure in your body. If you, for example, send some blood, say your doctor collects some blood from you and sends it to the laboratory for analysis. When you get the report back from the lab, there's going to be a value for each of the variables that they measure. So let's say how many red blood cells you have, how many white blood cells you have, how much hemoglobin you have, what your hematocrit is. There's going to be all these values on your report. And next to those values, there's going to be a normal range. So it'll say, let's say they measure a variable X, and your X variable, whatever it happens to be, comes in at, I don't know, 5. I'm making this up. Well, there's a normal range where that should be. Maybe the normal range is from 3 to 7. If you come in at 5, you're great, you're normal. So it's important to remember that for all variables that we measure to tell us whether or not organ systems are working correctly, for all of those variables, there's a range of normal. Humans are variable enough that there's never one value that we should all be at. So body temperature, 97 to 99 Fahrenheit. As long as you fall in there, you're considered normal. So what is that 98.6 value that we all know? That's called the set point. The set point for a variable is the most common number that people have. So if you went out and you measured every single human being, you measured their body temperature and you averaged it, you're going to come in at 98.6. There are some people whose body temperature is literally 98.6 most of the time, but there are lots of people who almost never are at 98.6. You know, they might be at 98 or they might be at 98.3, and that's still perfectly normal. They're still in homeostasis for their body temperature. So normal range and set point are two different things. What happens with feedback is it keeps you in the normal range. Okay. Feedback, negative feedback. Remember, that's the most common feedback that helps maintain homeostasis. Negative feedback is designed to keep us in that normal range. It may or may not bring you to your set point, but it's going to keep you in the range that you should be in. So if you look at this picture from lecture, see if I can find it here. That's what this picture is all about. This graph that you can see here, this shows a normal range for a variable and a set point. So there's a low value down here, and then there's a high value. And as long as the variable, whatever it is you're measuring, again, blood pressure, heart rate, whatever, as long as it falls in this range, you're considered healthy. You're in homeostasis. You're in an efficient, effective state of health. Your body is working effectively. The black line in the middle is that set point, what we think of as sort of the ideal value. Now, notice what the graph is doing. It's going up, it's going down, it's going up, it's going down. When we are alive, our variables, our organ system variables are constantly changing. Think about your heart rate. When you're sitting down studying and you're relaxed, your heart rate slows down. When you get up and you realize you're late and you run up a flight of stairs to get to your next class, your heart rate goes up. Your heart rate changes during the day, and that's okay because it stays within a normal range. As long as it stays in a normal range, your cardiovascular system is perfectly healthy and happy and it can work effectively. So where does the negative feedback come in? As the variable changes during the day, as it goes up and down during the day, negative feedback opposes it in order to keep it in the normal range. Let's think about body temperature. So when you get up in the morning, when you first wake up in the morning, your body temperature is actually lower than it is during the rest of the day. When we first wake up, we're actually a little cold. So let's say your body temperature came in at this value right here on this, this y-axis. Okay, so body temperature came in, let's say around 97.5. There are thermal receptors. There are receptors in your body that are going to pick up that information. Remember, we said the receptor detects the change in the stimulus, whatever that variable happens to be. That information is going to be sent to the control center. Remember, we said brain or spinal cord. That information then is going to be interpreted by the control center. The brain and spinal cord are going to decide, oh, she's 97.5 right now. That's a little low. That's below the set point. And that control center is going to send out information to help start to warm you up. Now, when it comes to body temperature, there are a couple of things that your brain and spinal cord can do. They can send out signals along efferent pathways to your skin primarily, but also some blood vessels in your body. What'll happen for temperature is sweat glands will be involved, and small blood vessels will be involved. And inside your body, your skeletal muscle can be involved in regulating your temperature. So sweat glands, small blood vessels, skeletal muscle. Skeletal muscle doesn't usually get involved unless you're close to going out of normal range, but I digress. You're a little cold in the morning. What your brain and spinal cord are going to do, what your central control is going to do, is send out information along efferent pathways to start to warm you up. So we don't want you to sweat because that's going to cool you down. So sweat glands will stop being active. You will not produce sweat. And your blood vessels in your skin are going to start to constrict. They're going to get smaller and tighter because that will help warm you up. That will help direct your warm blood towards the center of your body, towards your core, and that'll warm you up a little bit. If you're particularly cold or you're particularly sensitive to cold, you might shiver. Your skeletal muscle might start to contract and you might shiver. That helps warm you up too. Because when skeletal muscle contracts, it generates heat. Your body temperature is going to start to go up because of the negative feedback. It was getting low. Negative feedback will oppose that and start to bring it in the other direction, up. Now, here's the key part that some people miss. Remember the normal range. Your body temperature will start to go up because you need to warm up. It'll keep going up. It'll keep going up sometimes, but it won't be allowed to go up out of the normal range. If it hits that top temperature, remember we said that's 99. If it gets to 99, negative feedback's going to kick in. Negative feedback opposes the variable. If it gets to 99, negative feedback is going to start bringing it back down. This time we're trying to cool the body. So yeah, you might start to sweat. Your blood vessels are going to start to dilate because when blood vessels dilate, they lose heat. Your body temperature is going to start to come down. It might stop, but if it gets too low, If it gets down to that low value, 97, negative feedback's going to kick in and it's going to start taking it back up again. That's what this graph is showing us. It's showing us these ups and downs during the day. Your temperature can vary quite a bit. It might stop, say it stops right here and you spend hours and hours right at this temperature right here. That's fine, you're in normal range. But if for some reason it gets up to 99, negative feedback's going to kick in. Negative feedback opposes the change in the variable. So if temperature is too high, negative feedback is going to take it down. If it gets too low, negative feedback is going to take it back up. If it gets too high, negative feedback is going to bring it down. If it gets too low, negative feedback is going to bring it back up. It stays in the normal range. That's homeostasis. It doesn't mean your body temperature stays at 98.6. It means your body temperature stays in the normal range. Okay, does that make sense? We want to be in homeostasis. That's the state we want to be in. Negative feedback allows us to stay in homeostasis. Now, sometimes what students get confused about is something more extreme, something like a fever. And they'll tell me on an exam, for example, they'll tell me that when a person gets a fever, negative feedback will kick in and it will bring them back into normal range. That's not correct. Negative feedback keeps us in normal range. If you get a fever and your body temperature goes out of normal range, remember, fevers are perfectly natural. If you get a fever because you're sick, because let's say you have an infection, your immune system creates fever. It creates that high body temperature in order to try to kill the bacteria that maybe has gotten into you. That's what fever is for. Fever helps attack pathogens that get into our body, and your immune system creates that fever by releasing chemicals that'll warm you up. If you have a fever, you are out of homeostasis. You're out of it. You're not in optimal working conditions right then. You're not in a stable, effectively functioning form right there. You're out of homeostasis when you have a fever. You're in an unstable condition. It's an important condition to be in because you have an infection, but it's going to be temporary. It's going to be temporary. Once that infection is dealt with, if you will, once you've started taking your antibiotics and your immune system determines that it's time to stop the fever now, your body temperature is going to come back down into normal range. Now you're back in homeostasis. You could say the same thing for hypothermia. Sometimes people go, especially in New Hampshire, sometimes people go for a walk in the woods and they don't have enough warm clothing on in the winter and they get in trouble. Their body temperature starts to go down. As long as it's in the normal range, negative feedback is going to kick in. It's going to try to warm you up. You're going to shiver. Remember, we said your blood vessels are going to constrict in your skin and in your extremities. Your hands are going to get really cold. Your feet are going to get cold. Your nose is going to get cold because your body's trying to keep all of your heat in your core. That's negative feedback. But there will come a point, if you can't get inside and you're not wearing enough clothing and it's cold enough, there will come a point where you will go out of the normal range, right? And you'll become hypothermic. Your core body temperature will leave the normal range and it will become too low. People who are hypothermic can get down to 96 and 95 and 93. And they're way too cold. They are not in homeostasis at that point. They have left homeostasis. Okay, they are in an unstable condition. The human body does not perform efficiently at 93 degrees. As long as they are out in that cold environment, if they don't get warm, they're going to die, right? You're going to die if you can't get warm. You're not in homeostasis, you're unstable. And if you stay in that unstable cold state for too long, you're going to die. So, but if you come, let's say you find a nice little cabin in the woods. And so you go in the cabin and you start to warm yourself up. Your body temperature will come back up. And as soon as you get back into normal range, negative feedback is going to kick in. As soon as you get into that normal range, negative feedback is going to start to kick in and try to warm you back up again. Listen, negative feedback will, I should say this, negative feedback will keep trying. Even as you leave the normal range and you get colder and colder and colder, negative feedback will try, but you're not in homeostasis anymore. You're not in your normal variable range anymore for body temperature. That can be an emergency. That's an unstable situation for the human body to be in. So remember, negative feedback is working to keep you in your normal range. Okay. Fever, hypothermia, those are abnormal conditions. Those are out of homeostasis. Okay. Make sense?
Yep.
Now, I do have to mention positive feedback because there are a few positive feedback loops, and we talked about those in lecture. Childbirth is the one that everybody talks about. Remember, we said in a negative feedback loop, the response is in opposition to the way the variable is moving. So if body temperature is going up, negative feedback is working to bring it down. If body temperature is going down, negative feedback is working to bring it up. Opposition. Positive feedback reinforces the change. Positive feedback keeps pushing the variable in that same direction until a climactic event occurs. That's our definition. In positive feedback, as a variable starts to change, the positive feedback loop will reinforce that change. It will help it to keep happening until a climactic event occurs to break the feedback loop. Childbirth is the sort of the famous example. When a woman goes into labor, and the fetus starts to drop in her uterus and her cervix starts to open up, to dilate, she's going to release hormone to help that happen. She's going to release oxytocin in order to help her cervix open up so the baby can be delivered. Now, as she releases oxytocin, her cervix is going to contract. Sorry, I should say her uterus is going to contract. It's going to crush in on that fetus. Now, that is a change from normal. Positive feedback is going to reinforce that change. That contracting uterus, it's going to push the baby's head down onto the cervix. The pressure on the cervix causes more oxytocin to be released. It doesn't cause less oxytocin to be released. It causes more to be released. That's going to make the uterus contract more, which is going to make the baby's head press on the cervix more, which is going to cause more oxytocin to be released. This is a positive loop. It's just going to keep getting worse and worse and worse. More contraction, more pressure, more oxytocin. More contraction, more pressure, more oxytocin. And it keeps going and it keeps building until a climactic event occurs. And of course, the climactic event is the birth of the fetus out through the birth canal. At that point, no baby's head pushing down on the cervix anymore. So no more oxytocin. And with no oxytocin, the uterus will begin to relax and the loop ends, the loop breaks. There aren't a lot of positive feedback loops in the body. There really aren't. There's a handful of them. Some of them are really complex to talk about because they're purely hormonal. But another really good example of positive feedback is blood clotting. There's something called a clotting cascade in our body. And when you start to hemorrhage, when you start to bleed, when a blood vessel gets broken or opened, there's a series of events that occurs that helps build a blood clot. And what'll happen is those events will, obviously there's a problem. The variable has been affected. The variable of, your normal blood flowing through that blood vessel has been altered because the vessel has been opened. And so something's changed. A variable has changed. A positive feedback loop is going to happen. And the positive feedback loop through the clotting cascade is going to help build a clot. The positive feedback loop is going to keep reinforcing the clotting cascade until a climactic event occurs. And the climactic event that occurs is the formation, the full formation of a clot that's large enough to fill the hole in the vessel. So positive feedback kicks in as blood is leaking out of the vessel. And it starts this clotting cascade. And the clotting cascade is going to start to build a clot. But rather than having the change in the variable be opposed, the change in the variable is going to be reinforced. As the clot is produced, the clotting cascade will be reinforced and the clot will get bigger. And it'll be reinforced and the clot will get bigger. And it'll be reinforced and the clot will get bigger until a climactic event occurs. And that climactic event is when the clot is big enough to stop the hemorrhage, to stop the blood loss. So up on Canvas, I actually posted a little handout for us. It's just optional if you want to take a look at it. It talks about blood clotting as an example of positive feedback. So most of the mechanisms that help keep our body in homeostasis, most of the mechanisms are negative feedback loops. They're going to oppose the change in the variable in order to keep it in the normal range. So I've talked a lot about that, but it's important that you understand that concept because, like we said earlier, in order for the human body to function optimally, to work effectively, in other words, to be healthy, it has to stay all of the different variables that we can measure, all of the different variables for all of the different organ systems. They have to stay in their normal range. That's homeostasis. That is a state of stability that the body can be in. And our bodies work very, very hard to keep us in homeostasis. So yeah, the other thing that I will say, and then I'll let you go. The other thing I do want to say, I want to talk just a little bit about those essay questions on the exams. Where students get in trouble most of the time is not in the accuracy of their answers, but in the completeness of their answers. I like to give a little anecdote, and it's a silly one, but I think it works. Let's say that you read an essay question that said, explain how to make a peanut butter and jelly sandwich. And then it said, in your answer, describe the tools that are necessary and the process that is involved. A lot of students, in my experience, a lot of students will read that, and what they'll hear is, tell me how to make a peanut butter and jelly sandwich. And they'll say something like, put some peanut butter and some jelly on bread and then put the pieces together. And that will be their answer. That answer is technically accurate, right? You put peanut butter on bread and you put jelly on bread and then you put the two pieces of bread together. That's accurate, but it's not complete. The question said, in your answer, describe the tools that you need and the process that's involved. So a complete answer would say things like, you're going to need some kind of peanut butter. I mean, it could be creamy peanut butter, or it could be chunky peanut butter. It might be natural peanut butter. And if it is, you're going to have to stir it to make sure it's all mixed up. You're going to need a knife because you're going to have to get the peanut butter out of the jar. And then you're going to spread that peanut butter onto bread. Oh, and by the way, you can use any kind of bread. You might use white bread, or you might use wheat bread, or you might use whole grain bread. You might use gluten-free bread. There's all kinds of jelly you can choose. Some jelly has seeds in it, some doesn't. You have to pick the kind you like. Put another knife, get a clean knife and put that knife in the jelly and take some up and put it on the bread. Do you see what I'm saying? Describe the tools you need and the process that is involved. The way I write essay questions, the way I write the question is I guide you to the information that I want. But if you don't read the question, if you don't really read the question and understand what I'm asking for, it's very easy to write an incomplete answer. So let's say I actually asked that peanut butter and jelly question. If somebody wrote down, let's say it was a 10-point question. If somebody wrote down, you take some peanut butter and some jelly and you put it on bread and you put the pieces of bread together. That answer would probably earn 6 out of 10. It's accurate. It's accurate, but it's not complete. So that's a forewarning when it comes time to take the first exam. When you get to the essay questions, spend a minute really reading the question and understanding what exactly I'm asking you to write. You actually will, by the time we get to that exam, you will know a lot. You will know a lot. And it's your job in an essay to tell me what you know. Don't just tell me a little bit. Tell me what you know. And like I said, I'm going to guide you in the way I ask the question. But you've got to read that question carefully to know how to write a complete answer. One of the things that kills me is when I see a student write like a 1-sentence answer for a 15-point essay question. You can't possibly write a thorough, complete answer in a single sentence. You just can't do it. So it breaks my heart when I see that. Breaks my heart. It's a 15-point question. So that's just a heads up on that before we get to that first exam. All right. Anything else I can help with tonight?
I'm good.
Good.
Yeah.
As we move into next week, you're just going to do the same stuff again. You're going to look at your to-do list. Look at your to-do list for week 2 and work through it. Watch some lecture videos and so on, and we'll go from there. And remember, if any questions come up between now, say, and next Friday, feel free to message me. Feel free to send me a message through Canvas. And we can work that way. Okay.
Yep.
Don't feel like you can't reach out if you have a question about something. All right. Enjoy the rest of the evening. Enjoy your weekend.
Great. Thank you. You too.
All right. We'll talk to you later.
Bye.
Bye.
Bye-bye.